Aradaza.
Yes, sir.
How old are you? Age?
28, sir. 28.
28. Date of birth?
Yes, sir.
What is the date of birth?
Sir.
What is your date of birth? Birthday? Your date of birth? Your birthday?
A birthday?
Can you let me know when what is your birthday?
A birthday. A birthday. The birthday, April 5, 1986, sir.
Can I know your height and your weight?
4'9", my height, and my weight is 46, sir.
56 kg. Right? Okay. Are you married or single?
Married, sir.
Married. With how many kids?
I have 4 kids, sir.
With 4 kids. How old are they?
Yes. 10, 8, 7, and 4, sir.
Okay, when you come here, who is going to look after your kids?
Sir?
When you are here working, who is going to look after your kids?
My husband and my mother, sir.
Your husband.
Yes, sir, and my mother also, sir.
Is your husband working?
No, sir.
No. How old is
He's
your...
driving, 31, sir.
Your husband is a taxi driver, is it?
Lapra. So to
Yes,
sit
sir.
down because
Driver,
because
sir.
the sons.
He's a taxi driver. Okay,
Yes, sir.
can you please sit a bit more towards the right side because there is a... that is better. The image is not very clear, but I think that's okay.
Yes, sir. Thank you, sir.
You put down a bit.
How is it?
You put down a bit.
How is it? No, wait.
This. Okay.
How old is your mother?
45, sir.
The mother is 45. Oh, it's very young.
Yes, sir. Yes, sir.
Have you got the permission from your husband to come here and work?
Yes, sir. Yes, sir.
Sure, because why? If you don't have the permission, then we give the calling visa and then you will tell that you cannot come here and work because of your husband, because of your children. So can I make sure that you will come and work once I get you the calling visa? Are you sure that you can come here to work?
Yes, sir.
Huh?
Yes, sir.
You won't change your mind? Will you
No,
change your
I
mind?
won't
No,
change
you
my
are sure?
mind.
Because why? Once you get employer, you get a calling visa. And now once you get a calling visa, you have to report to Manila. And if you change your mind, then we have a lot of problems. See? We have to cancel the calling visa. We have to do so many things. You incur a lot of cost and time. So can you please let us know that you are mentally prepared to come here and work, and you are definitely going to come once we get the calling visa for you. Can you assure? Can you assure me of that?
Yes, sir.
Can
Yes, sir.
Okay.
Yes, sir. I will not change my mind, sir.
Okay.
I'm willing to work with you.
Okay. Thank you. What's the reason for you to come here and work?
So that I can spend education for my kids.
So that you,
I work.
so that you have to work a bit. So that you have to get the money to give education to your children. That's a very good mother. You have to be responsible. And then when you come here, you must work properly. Don't give us problem. Then you will definitely have a good life here, and also a good life in in the Philippines because you'll be able to send money back.
Okay, sir. Thank you, sir.
And do you think you will feel homesick or not?
Sir?
Do you think you will feel homesick or not when you come here?
I think, sir, I'm adjusting. It's normal. It's normal, but I'm willing to work, sir.
I see. Okay. But you have to work when you are here. Whatever it is, when you're homesick, you have to work and make it as an inspiration for you to work. When you're homesick, you must think that you love your people. That's why you get homesick. When you love your people, you must be able to help them by supporting them with some monetary benefits. If you come here, you feel homesick, you don't work, nobody is going to pay you. Okay?
Okay. Okay,
So when
sir.
you're homesick, you make it as an inspiration for you to work harder because you love them. Only you feel homesick. Am I right?
Okay, sir.
Okay.
Okay, sir.
What is your educational level?
Nursing aid undergraduate for first semester. I finished first semester in nursing aid.
You finish?
Not yet, sir. One semester.
Oh, I see. You have got some. You have attended some course on nursing. I see that. You are a nursing aid undergraduate. So how many years were you in the nursing school?
First semester, sir.
You're in the first semester.
Yes, sir. But I work as a private caregiver, sir.
Oh, I see. You have worked as a caregiver before. That means private caregiver.
Yes, sir.
And where were you working as a private caregiver?
Yes, sir.
Where were you?
Almost a year.
Huh?
Almost a year.
Almost a year. Where, in a hospital or in a nursing home or what?
In a nursing home, sir.
Or for a year. You were looking after people who are sick, invalid, or just old folks?
Yes, sir.
Who are the people you are looking after? Are they invalid? People who cannot walk, who have problems
yes,
with
the
the...
people, sir.
Huh?
I talk the driven people, sir. The driven.
I really cannot hear you properly. I'm just asking you, the nursing home, those people who are there, are they invalid? That means people who cannot walk, or are they just old folks?
Oh, yes, sir. Yes, sir.
They are just old people or people who cannot walk?
They cannot walk, sir.
Oh, I see. They are invalid in the nursing home, and I suppose there are old folks and people who are invalid lah, where you need the support of the nurses. Am I right?
Yes, sir. Yes, sir.
So, can you just describe what were you doing in that nursing home? What was your job?
I think I give her a medicine, sir, in the right time. Then
Medicine?
Then I feeding him in a feeding tube, sir. Then it has
Feeding.
sleep you. Then I clean him.
You clean them. That means you bathe them, is it?
It has a sleep you.
What about the sanitation part? You change the napkin or? Huh?
Sir, the diaper. I change her diaper and
Oh, I see.
taking a bath.
So you take bath for them, change the diapers, you feed them,
Yes, sir.
and of course sometimes you have to support them to get up from the bed. You roll them over the bed. Am I right?
Yes, sir. Yes, sir.
So how do you find the job? Is it challenging or is it tiring or what? Or is it something that you? Huh?
It's challenging, sir.
It's challenging,
And inspiring.
But do you have that type of type of attitude to care for these
Yes, sir.
sick people?
I have a time for a teacher because my duty is 8 hours.
I see. So you are very caring type, You care for these sick people. That's very good, So when you come here, we are not sure. We will try and look for an employer, whereby if they have somebody who needs your help, are you willing to work for them? Somebody who has got a mother who is maybe half paralyzed or old person who needs your support. Are you willing to look after them?
Yes, sir. But it's
You're willing, So
yes, sir.
let's say I have an employer who has a mother or even a father who is bedridden.
Yes, sir.
Who is bedridden. Are you willing to look after by taking care of them, change the diaper, bathe them, feed them,
Yes, sir.
and then once in a way take them out on a wheelchair. Can you do the job?
Yes.
Yes,
Yes, sir. I can do the job, sir.
What about looking after children?
Sir?
What about looking after children just in case an employer, has children, wants to employ you to look after the children or baby? Do you have any experience?
Yes, sir. I have an experience, sir, because when I go to Manila at 2004, I still take care of a special child.
Or you have the experience of looking after children in where? In overseas or in Philippines?
In Philippines, sir, and Manila City. In Metro Manila, sir.
Oh, you have only worked in Philippines before, huh? You have not been to overseas, right?
Sir?
You have not been to overseas to work, huh? You have only worked in Philippines as a housemaid. Am I right?
Yes, sir. Yes, sir.
So you also look after children and baby. Do they have a baby while you're working in the Philippines?
Yes, sir. I work, sir.
No, while you are working in the Philippines, the family, how many children are they having?
There are two children, sir. One is a special child.
Or one is a special child.
Yes, sir. Late emotional development.
I see. And how old was the child?
5 and 3.
Which is the special child?
The special child is 5 years old.
5 years old, I see. Can the special child walk, or can the special child, is it a mentally handicapped child?
Yes, sir. Yes, sir.
And there are how many people in the family? The father, mother, and the two children, is
Yes,
it?
father, mother, then the 2 kids. It has a grandmother also, sir.
Oh, I see. That means the mother, father, the 2 kids, and the grandparent of the kids. Am I right? So
Yes, sir.
there are
Yes,
five person in the house.
Yes, sir.
And you've been working there for 1 year.
What number?
Yes, sir.
This one.
Almost a year, sir.
Almost a year. Then why did you leave after working for a year?
Yes, I go to my own town because I win a motorcycle. That's why I just...
I see. So you went back to your own hometown. Where is your hometown, or where is your province?
And by latest, sir, there in Tacloban City.
In Tacloban.
Yes, sir.
Oh, your house is in Tacloban, you mean?
Sir?
Where is the province that you come from? Is it Tacloban?
Near in Tacloban, sir.
Oh, well,
By latest.
I see. Are you affected by the I think there was a disaster, earthquake or something like that?
Yes, sir.
You are affected?
I'm very...
Huh?
Yes, sir. I'm very affected for
I see.
Yolanda High, sir.
Oh, I see. So, is everything okay now?
It's okay, sir.
Okay, so that means you have to work a bit hard to help your people in the Philippines, especially your children, your mother. Am I right?
Yes, sir. Yes, sir.
So now, if I were to find an employer for you, whether it's looking after old people or invalid people, or look after children, you are okay, is it?
Yes, sir. I'm okay, sir.
I see. So both you have experience looking after old people and looking after children, and you have at least about a year of experience. Am I right?
Yes, sir.
Do you think that you have problem with the food here? Can you get used to the Malaysian food if you come here?
I think, sir, I can adjust.
You can adjust,
Yes, sir.
Can you cook?
No, No, sir, but I'm willing to learn.
You don't know how to cook at all. You can't even cook the Philippine
Yes,
food.
sir.
Huh?
Only Filipino dish, sir.
Ah, I see. You can cook some Philippine dish lah, but
Yes, sir.
in your house, do you do any cooking?
Yes, sir. I can do cooking, sir. Pancit and also adobo. That's
Ah, I see.
or fried chicken also. The favorite
Ah.
of my kids.
Do you like cooking?
Sir?
Do you like cooking? Do you like cooking?
Do you like to walk, sir?
No. Do you like to do cooking?
Yes, yes, sir. I want, I learned to...
Ah, I see. Okay, you
I
can
want to
learn.
learn
The
food,
mom
sir.
will teach you. So you have to learn, and then you could cook some nice food for the mom children
Okay, sir.
and the mom.
Okay,
But
sir.
you
Yes, sir.
but you have to
Okay,
learn.
sir. Thank you, sir.
Can
Yes, sir.
Can you look after pets?
Sir?
Let's say if the mom has a dog, mostly the family, the pet is a dog. You see, can you look after let's say a pet dog?
Yes, sir. Yes, sir.
Can
Because I have a fish in my house.
oh, you have a pet dog in your house.
Yes, sir. A cat, dog, and chicken.
Do you know of any medical problem that you have?
Okay? No, sir.
No, I mean I give you for examples, acute hemorrhoid or headache off and on, and severe abdominal pains during certain period, especially for females, and
No, sir.
no, and sinus. Do you have?
No. No, sir.
No, can you just stand up and show me your hands?
Yes, sir.
Can you just stand up? Show me your hands.
And
Okay. Just show that straight. Just show your hand. That. Just put your hand like that.
sir?
Can you show your hand? Can you put your hand straight? This way. I can't see. Can you stand a bit backwards? Okay, it's okay. Okay, I think you can sit down.
Okay, sir.
Yeah, you just sit down. The reason why I want you to stand up, so that I can at least see your profile, and can you tell me something about yourself?
I'm a simple mother, then I'm a simple mother, sir.
You're a simple mother, okay. What about your honesty, your willingness to work? That means whether you're hardworking, especially the honesty part. Are you the honest type? Or, are you the type that is lazy? Maybe can you please, let me know something about yourself? Are you the polite type?
Sir, I can hear you, sir.
I just want you to tell me something about yourself. For example, I'm the honest type of person, polite, maybe simple, simple and keep short
Yes,
hair.
And a simple mother, sir.
Simple
I
mother.
want to fix, I want, that I have the time to fix myself, sir,
I see.
so that I can look comfortable.
Can you say that yourself is an honest type, honest and hardworking? Can you say that?
Yes,
Yes.
sir. Yes, sir.
Honest, hardworking, good behavior. Are you having short hair or long hair?
Short hair.
That's long hair. Your hair is very long, isn't it? But let's say if the employer requests you to cut your hair short, are you willing to do that? Is it okay?
Yes, sir, I believe so.
Can it looks nicer. I think from here I think you're having short hair, but it looks so nice. Huh? It looks tidy
Sir,
and nice.
thank you, sir.
I see that in your photograph, because the long hair you tie up. I was thinking you're having short hair, and it looks so nice.
Okay, sir, thank you, sir.
Are you afraid of height? Or are you afraid of being left alone in the house?
No, sir, I'm not afraid, sir.
You're not afraid, because you've been working in the nursing home with the patients.
Yes, sir.
You should be a very brave girl. Am I right?
Yes. Yes, sir, yes, sir.
Is there any question you would like to ask me?
Sir?
Is there any question that you would like to ask me?
I asked, sir, if, because I'm English and Christian, do you have, if you know, in Malaysia, do you have a church there, sir, in English and Christian in Malaysia?
Oh, we got many churches here, okay? But there are certain things I have to let you know. If at all you request to go to church, you must get the permission from your employer. You are not allowed to go out alone. Because when you come here new, I think Kuala Lumpur is a very big place. Chances are that you will get lost. Because we have mates that come here, they go out, then they get lost. I think we have a lot of problem on that. And then some of them also they get cheated. So are you willing, to come here at least to stay with the family, even on a Sunday? But you go to church, I think you request the employer will make provision for you. Maybe will arrange for somebody to take you to the church. Maybe once the way. I can understand, you see, sometimes you need to go to the church in order to maybe to fulfill your religious rights. But you have to get the permission from the employer. Is that okay with you?
Okay, sir. Yes, sir, it's okay, sir. Thank you, sir.
So that means, are you willing to work without off days?
Sir?
Are you willing to work without off days?
Yes, sir. If you want, sir.
Can, okay. And
Yes.
are you willing to let the employer keep your passport for safe custody?
Sir?
Let's say your passport is a very important document. If the employer keep it for you for safe custody, is it okay?
Yes, sir. It's okay, sir.
Because why? There are cases of maid losing their passport, and it's very costly to get a new passport. Do you know that? It will cost about 200 over USD to get a new passport. If you lost the passport, to renew a passport, of course, it will cost you about 100 USD. But you lose a passport, it costs you, I think, 200 over USD. It's very expensive.
Okay, sir.
So we would like to keep the passport in the safe.
Okay, sir. Yes,
So
sir.
it's okay.
Yes, sir.
Just now you wanted to ask me something. I didn't really catch you. Can you ask me the question again?
What about, sir?
No, you wanted to ask me some question. Can you ask me the question again?
Do you have a kid, sir?
You're asking me about the church, is it? Yes, I think I have answered you the question. Is there any other question that you want to ask?
About your family, sir?
Okay, I'm not the employer, okay? I'm the agent who is interviewing you. I will put up in YouTube for the employer to see, because the employer is working, they cannot come. Okay, I have got in hand a few employers who is interested to employ the Philippine maid. And one of these employer, I think he has seen your biodata and he is interested to employ you. Okay, the family has got 5 to 6 person in the house. 5, that means you got husband, wife, 1 kid, and 2 elderlies.
Okay, sir.
Okay,
Yes,
and
sir.
the
Okay,
kid,
sir.
the kid,
Okay, sir.
the kid is already 15 years old, so not much of what to call you really don't need to look after him too much because he's going to school. Okay, the two elderly, one of them actually has to go for dialysis, so that's where you need to look after the person, probably to wheelchair him, take to accompany him to the hospital, and this person is a man. Is it okay?
Okay, sir.
Huh? And
It's okay, sir. It's okay, sir.
it's okay. He's only going for dialysis. Do you know what I'm trying to tell you? Dialysis, dialysis. That means to wash the. I'm sure you know because you have been a nurse before. Am I right?
Yes, sir. What term? The what?
Dialysis. That means just go to the. Dialysis. That means to clean the the kidney. He has got problem.
The what, sir?
He has
I
got
can hear you, sir.
he has got problem with the kidney, so he maybe once or twice a week he need to go to the hospital or the clinic, you see, to do the dialysis.
Okay, sir.
You need to
Okay,
help him, to accompany him. Is that okay?
Yes, sir. It's okay, sir.
Okay. Do you know your contract is for how many years?
2 years, sir.
2 years. Do you think you can finish your contract?
Yes, sir. I can finish the contract.
Contract you
Yes,
can.
sir.
So do you think of, let's say you finish your contract, do you think that you can extend your contract?
Yes, sir. I want.
I
If you
see.
want, sir, I want.
Yeah,
But I can
yeah,
send
yeah.
application for my sister.
Yeah. If you have got a good employer, I'm sure you would like to continue. Am I right?
Yes, sir.
We will definitely get for you a good employer. I think we have been finding all the good employers for all the non-stop housemates. So far, we don't have any problem on that. We will definitely get somebody who can work work along.
Yes, sir. I work hard, sir.
Okay,
so I
you can work hard,
live in new house.
Yeah,
Yes, sir.
you have to work hard. Okay.
Yes, sir.
What about housework? Housework. I'm sure you would have good experience in also looking after a house, cleaning a house, mopping,
Yes, sir. Yes,
sweeping.
sir.
You have,
Yes, yes, sir.
Telephone number. Each one ask for the telephone number.
Can I have your telephone number? Can you write and just let me know so that just in case I need to call you, because sometimes I cannot call you, see. The phone number is in your bio, but sometimes this phone number, I'm not sure why, see, we cannot get. But is it possible to give me your phone number now?
Okay, sir. Okay, sir.
Can you type?
Can you write it, sir?
Okay, what's the number?
Number ko na. 099, sir.
Huh?
0999.
Just a minute. Zero
Like no.
099
170.
099 once.
9.
Huh? But no, can you type on the Skype?
I-type ko naman. Type ko. Ipa-type ang nandun. Wala. Ipa-type yung number ko. Sa kanya. Just a minute, sir. Where, sir?
Can you type onto the Skype there? You ask the person in charge.
Your number na lang. I have my any number, sir, and globe, sir.
Huh?
I have one number and globe, sir.
I cannot understand you.
I have one number, sir.
Okay, never mind. You just give me that number. Just quickly give me that number. 099
099 170 1331
170 is it? 170 1331.
Yes, yes, sir. And the other one, sir, is 0906.
1232 199. Am I right?
Yes, sir. Yes, sir.
The other one is 09917 01331. Huh?
Yes, sir.
But one is 11 numbers, one is only 10 numbers. Why is it like that?
What number, sir?
No, one is only 10 digits, the other is 11 digits. So are you sure you give me the correct number? Because the 0906 got
0999.
0999, 3 nines you mean?
Yes, yes, sir.
Okay. Okay. Now I see that your biodata you gave me, are you willing to take care of newly born baby? You said no. So that means for baby you're not willing to take care, is it?
Yes, sir. Because I'm afraid of a newly born baby.
Ah, see. So you are
Yes, I'm
not.
willing to. Yes, sir.
And you saying laundry by hands and sewing of clothes by hand. You said no. But sometimes the laundry by hands, I think, is a simple job. You just need to scrub because certain clothing you cannot use by washing machine, you see. I'm sure you can do that. Am I right?
Yes, sir. Yes, sir. I can do this.
Yeah, it's a very simple job because certain clothing you cannot go into the washing machine.
Yes, sir.
Now, are you willing to work with a family where the father and mother-in-law or any relatives stay together? Okay, in this case, this family has got only 3 persons, but the mother and the father is staying with them. The father actually needs dialysis, so that's why the father is staying with them. So is it okay for you?
Yes, sir. It's okay, sir.
It's okay, huh?
Yes, sir.
Okay. But why is it when you put the preference, you put care of disabled invalid as number 5, the last choice? Why is it you put there?
Sir? Sir, I can hear you, sir.
I see that when you put the preference, what is the first preference? Can you let me know? In terms of just looking after children, looking after invalid, or newborn baby. Because newborn baby here, you put number 3. So what is your choice? Which one would you prefer? Look. Look.
A newly born baby, sir, is very sensitive. Unlike a years old baby, kid.
Okay. So what is your choice of your job? In terms of looking after children, in terms of looking after old people, in terms of looking after baby, which one would you like? Your choice of, your preference. Looking after old people and invalid? Is it okay? Your preference?
Yes, sir. Yes, sir.
Okay,
Yes, sir.
Then after
Okay,
that,
sir.
then after that with children,
Yes, sir.
Okay, I think that's all. I thank you very much,
Okay, sir. Thank you, sir.
Okay, thanks.